All right. Thank you, everyone, for being here. I'll be your host. My name is Alex. I'll get started by introducing my co-host here, Dr. Michael Hsieh.
Thank you, Alex. Thank you all for coming today. I'm a board-certified urologist at UC San Diego, and I specialize in men's health. I take care of men with fertility issues, erectile dysfunction, and other type of sexual problems such as low libido.
All right. Thank you, doctor. So this first slide here, we're going to talk about erectile dysfunction in general. So doctor, why don't you start by explaining what erectile dysfunction means to the sufferers?
As many of you can read on the slide, the textbook definition is when a man is unable to achieve or maintain an erection adequate for sexual intercourse. It's very common. It affects about half of the men in their 50s, 60% of men in their 60s, and 70% of men in their 70s.
Okay. Thank you, doctor. Moving on. So these are the main physical causes of erectile dysfunction. The top three there, you'll see vascular issues, diabetes, and medication. So Dr. Hsieh, would you mind telling the audience any other causes?
Sure. Other causes of erectile dysfunction can come from, also be related to psychological and also from after cancer treatment. I think it mentioned on the slide here, pelvic surgery, radiation, or trauma. A lot of the side effect from cancer treatment does involve sexual problems such as decreased sex drive, energy level, and erection problems. So having medical illnesses unrelated to erection can also cause erectile dysfunction.
Okay. And these top three issues that we mentioned, the vascular, diabetes, the medication, I'm sure a large part of our audience will be suffering from one of those. So do you mind giving us a little bit more insight into each of those and explain whether or not you feel these issues could be getting worse in society?
Sure. Erectile problems, it is becoming more common, and one of the most obvious reasons is that people are living older, and this is a problem of aging. As a man age, both from a neurologic standpoint and a vascular standpoint, your body just don't function as well. So it's not uncommon that older guys have more problem with erection problems. The second more common reason is that since men are living longer, they don't want to live 20, 30 years of their life with erection problems, and nor should they. And they are now seeking help to try to age well, and I think restoring a man's erection is important as part of aging.
Okay. Well, thank you, doctor. Next slide here. What is an erection? This is something that I know you don't feel like you may need to hear, but we want to go into a little bit of the science behind an erection, and that will help explain how we treat it. So Dr. Hsieh, why don't you go ahead and talk about these first two steps in achieving an erection?
So for men to have an erection, it is actually a very complex interaction between arousal, between the nerves and the vascular, the blood flow to the penis. As you can see on slide number 1, everything starts with a stimulation, and which is usually in the brain level. A man usually aroused by certain images that they see or certain touch, and the nerves basically tell the brain that now it's appropriate for them to be aroused, and leads to increased blood flow to the penis. As the blood starting to enter the penis, that's when the erection starts to occur. A man's penis is comprised of tissues that's able to expand with increased blood flow, and also, as you can see in the next slide, in slide 3, during the full erection, blood has to get to a man's penis and need to be trapped there to maintain an erection. So it's a very complex interaction between the artery and the veins. So for a man to maintain a rigid erection, blood is traveled into the penis by the artery and is trapped there by pinching off the veins. And after a man climax, and you will see in picture number 5, that's when other types of neurotransmitters and hormones in your body. The signals basically tells your body that now is ready to be relaxed, and that's why a man, the blood drains from the penis, from the veins, and returns to his normal flaccid state.
Okay, so erectile restoration. We're going to get into kind of a recap of what we discussed. The top 3 causes for erectile dysfunction are vascular issues, diabetes, and medication, which Dr. Hsieh explained. Is there anything else you want our viewers to know before we talk about treatment options?
Sure. I think erection problems is very significant to a man's quality of life, and that I think all men should not be embarrassed to talk about their erection problems. And for almost 100% of the men, we are able to help them, and there's different treatment options that we will go over. And we can, like I tell all my patients, that I'm able to restore every man's erection. It's just how far we have to go. And when we consider these treatment options, I want you all to also think about what's important to you and your partner, because each decision is pretty much individualized for the man and their partner.
Oh, perfect. Thank you, doctor. Now we can discuss current FDA-approved treatment options, along with a solution that we're pretty excited about, a solution that has helped over 400,000 men have cure their actual erectile dysfunction. So we'll get into that right now. This next slide is introducing oral prescriptions. It's kind of a first response, wouldn't you say, doctor, to erectile dysfunction?
So yes, the first line of treatment for erection problem is oral medications or pills. And it's most of my patients refer to them. And there's many of them on the market, and they all work. There is a timing component associated with them. Most of the time, you do have to plan for these things to happen. They need to be taken at appropriate intervals, and they'll also only last a certain amount of time. And I think a lot of times patients try these medications and they don't work. Partially might be due to the fact that they were not counseled properly on the directions on how to take these medications. And they're just like all medications, there are side effects associated with these medications. So, but for most men, oral medication is the first line treatment. Yeah,
it's sometimes one of the only treatment options that they're familiar with. It's something that's advertised pretty regularly. The science behind oral prescriptions, if you just want to touch on that.
We call PDE5 inhibitors, or phosphodiesterase 5 inhibitors. Basically what it does is that it prolongs the signals in your body to increase blood flow. So it improves the circulations of your whole body and not just the penis alone. So sometimes one of the side effects of the medication is flushing, because it increases blood flow to the face. That's why men have flushing as one of the side effects. And all the medications do is that it helps improve blood flow to the penis, and as I mentioned earlier, is one of the key components of an erection, and that's how they work.
Thanks for clearing that up. Excuse my confusion. Anyways, so moving on, oral prescriptions, common side effects that we want to touch on. Some of our viewers may have had some of these last few times they took some oral medications, but why don't you go into the side effects and explain those?
Okay. So the simplest way to think about this is when a man takes a pill, the pill has to go around his body before it reaches the penis to work. So as it goes around the body, that's where the side effect comes from. Some of the common side effects associated with increased circulations, as I mentioned earlier, is facial flushing. Other specific side effects, sometimes men can have stuffy nose, upset stomach, back pain, or vision changes at night. It is important to know that these medications cannot be mixed with other medicine, specifically men with heart problems that take nitrates for their chest pain. Medication for erection problem can also lower blood pressure. So when men are also taking other medications for high blood pressure, this can lead to an unsafe drop in blood pressure. That's why before taking these medications, you need to review your current medications with your doctor. Therefore, we want to make sure that you're the right candidate for these medications.
Perfect. Okay. Let's move on to the second cure or use for dealing with erectile dysfunction is what's called the vacuum device. Dr. Hsieh, can you explain what the vacuum device is and how it works?
Sure. I think most men is aware of a vacuum device. I think most when I bring this up to my patients, usually they think about Austin Powers in the movie, and it worked very simply. It's that the vacuum pump creates a negative pressure, so therefore blood is drawn into the penis, and there is an elastic band or elastic ring that after erection is achieved, you slide onto the base of the penis to help maintain erection. And they do work for men who cannot tolerate oral medications or is not good candidate for surgery. This is one way of help them achieve an erection. However, in my experience, the vacuum erection device is not as well tolerated for men and doesn't always result in a satisfactory experience during intercourse. I mainly use vacuum erection device as a rehabilitation tools. A lot of men, after prolonged periods of not having a full erection, they can have scar tissues internally and leads to deformity of the penis or shortening of the penis. And the vacuum is a good way of rehabbing their body back into their shape.
Okay, so you touched on this a little bit, the most common reasons for discontinuation. The most common side effects, if you want to just touch on those real quick,
Sure.
Dr. Hsieh.
The side effect is usually discomfort. And discomfort usually is associated with the constriction ring or the constriction band that we place at the base of the penis, because it is pretty tight, because that's what it takes to trap the blood in the penis. And once a man wears a ring, usually when they climax, they don't see too much semen from ejaculation because it's constricted, and sometimes by prolonged wearing of the band, it can also cause numbness to the penis. Therefore, the sexual experience is not always what they desire.
Okay. Thank you, doctor. Next form of treatment for erectile dysfunction, intraurethral suppositories. Doctor, why don't you explain those for us?
Great. So when a man fails or cannot tolerate oral medication, we have to deliver the medication directly to the penis. And intraurethral suppository, in this very long medical jargon word, is simply you delivering the medication into the tip of the penis where a man urinates. The medication is absorbed locally inside the penis, therefore by increasing blood flow to the area and hopefully achieve an erection.
Perfect. And the most common side effects?
So unfortunately, just like the oral medications, these are medicine that you have to time and you have to do it at appropriate timing and dosages. So sometimes people don't like the lack of spontaneity associated with these medicine. And for men with more severe form of erection problems, usually a higher dosage of the medicine is needed. The higher the medication dosage, sometimes it can burn or cause pain. So pain is the most common reason why a man stop or discontinue the treatment.
Alrighty. And now we have self-injections. Doctor, why don't you explain the injection therapy?
So like the suppository, the injection is another form for us to deliver the medication directly to the penis. And for the most part, it is very effective in men who has failed the pills or the oral medications. How it works is that it's no different than diabetics give themselves an insulin shot, except you are giving yourself an injection, obviously, into the penis instead of into the belly. The medication is very potent, so usually a small amount is required, and this need to be injected properly because it can cause pain or overdose if you're not following the directions.
Okay, so you mentioned pain. You mentioned a dislike for injections, not for those that have a fear of needles, possibly. But what are the most common side effects of the injections?
So most common side effect is pain. Just like any injection, it is associated with pain. However, when being taught properly, usually the pain is minimal. Like I mentioned earlier, it is a very strong medication. Therefore, proper dosing is important because a man can overdose on this medication and lead to a condition called priapism or erection lasting longer than 4 hours. For men with erection problems, they all think that it's a good side effect to have. Unfortunately, when you do have that condition, then it is an embarrassing trip to the emergency room. Therefore, before any man starts injections, the first dosages is always administered in the doctor's office under a monitor setting, where we teach you the proper technique and monitor you for any potential side effect.
Okay, and can you real quickly explain fibrosis, penile fibrosis?
Fibrosis is simply a medical term for scarring. Sometimes when a man have prolonged erection or use the injection for long periods of time, scar can build up inside the penis, and that along with prolonged lack of erection can cause penile curvature problems or shortening of the penis.
Perfect. Thank you, doctor. Finally, penile implants. The previous treatment options were first and second responses. Some of our audience members may have been through those and be displeased or may not find their optimal results from those treatment options. So we have a penile implant. Can you explain what the penile implant is, doctor?
Sure. It's a most definitive way of restoring a man's erection is surgery. And for some men, even though it's not the first line of treatment, that's often their best treatment option. What it does is that, and this is one of the very common procedures that I do at UC San Diego, and basically what I do during surgery is I replace a man's normal erection mechanism, as we shown earlier a few slides ago, with an implant. And the implant comes in various types. And the most commonly used are the one, it's called an inflatable penile prosthesis. Basically, it's the most natural because when a man is not having intercourse, it is soft and flaccid. And when a man wants to have intercourse, it's operated through a pump in the scrotum in front of the testicle to achieve an erection.
Okay, and we want to dive a little bit deeper into this one. I'll show you a video of exactly how it works. If you want to narrate this, doctor.
So all three components, the pump, the cylinders, and the reservoir, are placed surgically. So as is shown in the video here, a man operates the prosthesis entirely through a pump that's hidden inside the scrotum skin. So when a man wants to have an erection, he pumps the fluids into the cylinders, and when a man is done, he also use the pump to drain the fluids into the reservoir or the water balloon.
Now, there are three types of penile implants, doctor. Can you explain the three types?
So the three type basically is just different mechanisms of how it works. The three-piece or the inflatable penile prosthesis is the most common type that we use and is most associated with the highest patient satisfaction. It has a pump in the scrotum, cylinders inside the penis replacing a man's natural mechanism of erection, and a reservoir, which is a water balloon that's inside the abdomen where the fluid's kept when a man is not interested in intercourse. Two-piece implants are for men who has previous abdominal surgery where it might not be we might not be able to place the reservoir. Therefore, it is a little bit larger pump in the scrotum, but it is considered inflatable, meaning that when a man wants to have intercourse, we can pump it up, and when a man is not interested in having intercourse, then it is soft and flaccid. Lastly, the one-piece malleable implant means that we basically just put a material that's inside the penis that's able to be bent, and it is rigid most of the time, and that when a man wants to have an erection, it just manipulates it to an erect position.
Okay, perfect. And will you touch on real quickly the pre- and post-operative circumstances, I guess you would say? What happens before, and then what can they expect after the procedure?
Sure. Just like any surgery, it is important to talk to your surgeon about the procedure, about the risk and benefits before moving forward. Before surgery, I generally go over, show the implants to my patients in a model form, and therefore they understand kind of how it works. And also, it's important for me to review their medical problems because it is a procedure done under general anesthesia. So sometimes they will need medical clearance by their cardiologist or their primary care doctors before we move forward with surgery. The surgery generally takes about an hour to hour and a half, and it can be done as an outpatient, or they spend one night in a hospital for observation. It's like I said, it's performed very commonly here at UC San Diego. Most of the time they go home without a catheter, without a drain by day 1 after surgery. Usually it takes about 4 to 6 weeks for the body to heal, so therefore we don't recommend any intercourse during this time period. About 4 to 6 weeks after surgery, we teach the men how to operate the pump, and then therefore they're ready to resume intercourse. Some of the complication of the procedure is, number one, it's a man-made implant, therefore it doesn't last forever. However, there's a lot of advancements in technology now that it works for up to about 13 years. So if a man is going to live beyond 13 years, there's a chance they might have to come back for almost like a tune-up second procedure. One of the things I worry about the most doing prosthetic surgery is infection, because when a man has an infection of any implant, not just penile prosthesis, that needs to come out, because there's no way for your body to heal, even with just antibiotics and anything. So therefore, we're very careful during surgery. Before surgery, we give every man antibiotics, and also we clean the area of surgery 3 times with 3 different kind of preparations or surgical scrubs. Afterwards, we put a man on antibiotics for a week, and therefore to minimize the chance of infection.
Okay, and our audience may want to know success rates for this surgery. I don't know if we touched on that, but can you mention any success rates?
Sure. About 95 or 98% of men will be very satisfied after the penile implant surgery, because it does restore their erection when they have otherwise already failed other form of treatment option, like I mentioned earlier. But more importantly, studies have also shown that over 90% of their partner is very satisfied as well. So therefore, it is a treatment option with both patient and partner satisfaction.
Perfect, and that's a perfect introduction to this video. We actually have a patient testimonial. This is Harvey, and that's his wife, Ann. Harvey has a penile prosthesis, or a penile implant. So I'm going to show you real quick just the first segment of this video, which will be his experience up until getting the penile prosthesis. Then I'm going to pause the video and then skip ahead and show you just kind of his post-operative experience, so you guys have a good expectations about what that's like. So here we go.
There was a time where we tried different types of pills, Levitra, Cialis, and of course Viagra, the big one. They were not all that, they didn't do much good. Okay. Because what was going on, quite often, yes, I could have an erection, but then I'd lose it real fast before we could complete the act of sexual encounter. I've tried for a little better than 2 years. I did what they call Trimix, which is the injectable directly into the penis. Needle is a insulin needle. Yeah. Got a little sting when you first put it in. 2 problems with it. One was it has to be refrigerated at all times, never frozen. So when you travel, you have a little cold pack. Okay. And then over time, like with a lot of medication, I had to continue to increase the dosage. So Trimix is made of 3 different chemicals. I don't know. You have to go to a compounding pharmacy. And at one point, at the end, I ended up with what was called quad mix. They added a 4th chemical. And that's when we kind of drew the line. To give you a little background, at that point, we went to see the urologist we were using at the time, and he kind of, I won't say he threw up his hands, but he basically said, that's it. Okay? Well, we are a sexually active couple. Okay? We're not ready to sit down and clip coupons. So consequently, that wasn't it, as far as we were concerned.
Okay, then Harvey's going to explain that he did some more research, and he finally came to the conclusion that a penile prosthesis was right for him. So I'm going to skip ahead to when he explains his post-operative situation.
Same thing when it comes to the urologist. You don't want to be the first one, the first implant the guy's just done. But okay, go on.
Real quick, so Harvey was just finishing a part of the video where he explained that his first urologist did not know about the procedure, and maybe knew about it but did not explain to Harvey anything about the procedure when he came to him with his issues with erectile dysfunction. And Dr. Hsieh will give you a little bit more insight into that, but the case is some urologists are not trained in doing this procedure, so your urologist may not mention this when you come to them with your erectile dysfunction symptoms.
Back to the procedure. Yeah. The procedure itself was an overnight stay in the hospital. Some doctors, from what I understand, do it that way. Others do it as outpatients because you do have a catheter. Yeah. Okay. From what I understand from my wife, who was in the waiting room, I was sleeping during the process, so I didn't know that. It took about 20 minutes.
No, about 40.
About 45 minutes. Spent the night in the hospital. I'm sure they gave me pain medicine through the IV. You know, one of those things you don't know what they're giving you at the time. Went home the next day, had a prescription for painkillers. I was very, very fortunate. I only had to take one. And I'm sure everybody is different. We have a two-story home. That evening, I walked downstairs and had dinner.
Oh.
Had to continuously ice it because, of course, you've got swelling. Yeah. You've got to get rid of the swelling. Within 2 or 3 days, I guess. I'm just doing everything I would normally would do. Okay.
Realizing that it is a retired lifestyle, it's not like you had to get up and go to the office or go do manual labor or anything like that.
But also realizing that then came the real hard part. No sex for 6 weeks. 6 weeks.
You know,
that's the
like any surgery, it's more than just having the incision heal. Yeah. There's a lot of internal healing that has to take place. Yeah. So we've now been given this wonderful new toy, and you don't get to play with it for 6 weeks.
You also asked him here, how has it changed my life? Okay. For some people it would, for some people it would not. If you're a person who wants to continue to have an active sexual life, it makes a huge, huge difference because there's a point where you feel as if you're not a whole as a man because you can't sexually satisfy your woman. Okay? And I don't know if that's a natural instinct, but I think it might be. Since 3 years or 2.5 years that this has been in, it's made a huge difference. It's made a huge difference in my outlook. I'm whole.
Okay, we'll go ahead and stop it right there. And then we'll have Dr. Hsieh explain something Harvey mentioned that his urologist was not trained in doing the procedure. He found out later. His urologist actually never mentioned it. But these are the types of doctors that will know about the procedure and be trained on it. You want to talk about this, doctor?
Sure. Even though penile implant surgery has been performed for over 50 years, some of the techniques we got really good at it over the last probably 10 to 20 years. So depending on the urologist that you see, some might not have undergone a training back in the day because this wasn't as commonly performed back in the day. However, in today's urology, 2014, all urologists today knows about penile implant surgery, and they should be able to give you the proper counseling of what it's about, and also refer you to somebody else that perhaps they might feel more comfortable doing the surgery. Because just like any surgery, you want to go to a person who does these kind of procedure routinely, because higher volume usually translates to higher success. So therefore, all urologists is aware of penile implant surgery. I think a man should be able to feel comfortable inquiring about it to their doctor, and then their doctor should be able to refer them to a specialist if they don't do the surgery themselves.
All right. Thank you, doctor. So we'll go ahead and touch on the cost and insurance coverage aspect of this surgery. A lot of you are probably wondering, is this covered by insurance? So Dr. Hsieh, why don't you explain that scenario?
Okay. One of the biggest limiting factor for the treatment of erection problem is cost. Many of you have tried to seek treatment probably knows that insurance companies don't consider erection problem a medical necessity. Therefore, the coverage is oftentimes limited. So it's not uncommon for me to have to help a lot of my patients navigate the system and trying to get as much coverage as we can give on insurance companies. In terms of all the treatment options, the best coverage for erection problems is actually surgery, even though that's not the first line treatment for erection problem. For most men with insurance, whether it's government insurance or private insurance, penile prosthesis surgery is actually covered. However, I will refer you back to your own insurance companies to kind of inquire about this if it's something that you're interested in. At UC San Diego, we also have insurance specialists that's able to help you navigate a system. So that way, before you choose any treatment options, you understand not just the risks and benefits, but also the costs associated with each option.
Perfect. So that was a lot of information. We're going to be flashing on the screen here in a minute some links that you can go to book some appointments or make some phone calls if you have any questions right now about this stuff. So we'll show those here in a second. Finally, we want to wrap this up with some questions that our audience has submitted about erectile dysfunction that we may or may not have touched on. So the first one is from a gentleman in Fallbrook. He asks, which oral medication works best? Which oral medication works best, doctor?
That's a tough question, but it's a very common question. All of the patients come to me because the pills are very expensive, so they always want to know which one's the best before they try them. And my response to every man is that they all work differently, and that we have to follow different instructions for each of them. However, there's no way for a doctor to know which one works best for each patient. So it is part of a trial and error. So what we usually try to do is that we usually try to start a man on oral medication that's covered by their insurance, or we have a coupon program to help them from a cost standpoint. And it is a bit of a trial and error. So for the best one for any man would be the one that works and with minimal side effect, and that often takes a trial and error.
All right, thank you, doctor. And the next question is from a self-proclaimed long-time ED sufferer. He says that he's been using a combination of Viagra and Cialis for years, but he's reaching the point of tolerance that I think Harvey mentioned. His question is it unhealthy to maintain a regimen of high dosage, sometimes 3 pills at a time to keep an erection? If not, what do you recommend?
So when I hear about a man who is taking 3 pills at a time, pretty much over the recommended dosages, that oftentimes in my mind I'm thinking about we probably have to change our approach and change our treatment options. Because if a man's taking 3 pills to help him achieve an erection or cannot achieve an erection, taking 6, 8, 10 pills is probably not going to help. And this is a very common scenario when the oral medications basically stops working. So then we have to escalate this to either treating delivering the medication directly to the penis in the form of injections or suppositories, or start thinking about surgical approaches, because as I mentioned earlier, the medication also has side effects, and taking high dosages, even though it might not achieve an erection, it can still cause unsafe drops in blood pressure. So therefore, I don't recommend men taking super therapeutic dosages of these medications.
All right, thank you, doctor. The final question that we want to address is from a gentleman in Escondido. He asks, will my implant, referring to the penile prosthesis implant, will it be noticeable to my spouse, of course, when he's in the nude, and also I think he's referring to when he's fully nude and say the locker room, around the guys? Is it going to be noticeable?
That's a very good question, and I think penile implant is one of those things that most men hear about, but usually embarrassed to ask about. That one of the best part of the procedure or the approach is that it's completely hidden from a man's body. That's part of the reason why we have to do the procedure under general anesthesia, is that we had to place the entire device internally. So after the surgery, when your body, after the healing process has complete, it takes about 4 to 6 weeks, it's completely hidden inside the man's body. When a man does want to achieve an erection, he operates the pump, and it is able to mimic a normal erection that a man achieves naturally. Therefore, the spouse is associated with high partner satisfaction rate. And the advantage of an implant not only is not noticeable, is that because we replace a man's natural mechanism of erection with a mechanical device, a man can maintain intercourse as long as him and his partner wants. Therefore, it only goes down when a man chooses to. So that's another benefit. So it's not it's completely hidden inside the body. It's not noticeable at all, and it's associated with high partner and patient satisfaction.
All right, that concludes our presentation. Dr. Hsieh, do you have anything to mention?
I think what I will hope all men take away from this is that erection problem is very common, and you should not be embarrassed to discuss these issues with your doctors, because we now have other evidence that erection problems also can be linked to issues with the heart and other cardiac problems. So therefore, a man should not ignore these erection problems, and that almost all men can be cured. We just have to individualize the treatment options to you and your partner.
All right. Well, thank you very much, everyone who joined us. We look forward to seeing or speaking with you soon.